Inside this hotel suite in Dawson Creek, BC, a growing family waits.
It's just stressful, really.
They watch as the days go by and the costs add up.
The minute you find out that you're expecting, well then the thought process starts to go, and then the expenses, and like I said, you start planning.
His outfits and stuff.
I got a tour of the family's temporary home as Courtney Cornelius waits to give birth to her second child.
Some cute ones.
She and her family are nearly 500 kilometers from their home in Fort Nelson, BC, because there aren't any maternity services in their community of 3,500. So you're basically just kind of counting down the days until you go into labor?
Yeah. Yeah, and then I get to go home.
Maternity services were stopped in 2012. Women who are expecting now receive a memo that says, due to staffing issues, we're unable to conduct safe obstetric care in Fort Nelson. Officials say the hospital is equipped to handle unplanned deliveries in an emergency, but they advise women to head elsewhere.
A lot of girls have to come down by themselves, and then they don't know if their other half is going to make it for the delivery or not, or if they're going to have to do it by themselves, or if they're even have somebody to watch over their other children. Addie, do you want some cheese?
Then there's the financial toll. When Cornelius and her partner had their daughter 2 years ago, they say the extra expenses added up to about $4,000.
Right from Fort Nelson in the north all the way down to Oliver.
Jude Cornelson says more than 20 communities in BC have shut down their maternity services since the year 2000, in part because of difficulty recruiting and retaining doctors. She says it's a trend happening across the country.
Just to be clear, nobody's intentionally trying to dismantle these services. We're just not paying enough attention to them.
She says while it doesn't make sense to reinstate maternity care in every community, she believes officials should be doing everything they can to make sure women deliver as close to home as possible, because the further you travel, the higher the risk.
The women who have to travel more than 4 hours to access maternity care have a much higher infant mortality rate, so it's about 3.17 times higher. The women even who have to travel, for example, more than 2 hours to access care have a higher rate of low birth weight babies and preterm delivery.
Even those who don't travel as far can face very real risks. Just ask Bikram and Jasprit Sandhu.
Hi to everyone.
They run a restaurant in Weyburn, Saskatchewan, but they were told to drive 115 kilometers to Regina to deliver their son. They didn't make it.
She had a lot of pain, and she was like, something is happening, something is moving, and she said, just stop the car. Everything was happening so fast that I had to deliver the baby.
At first, their son Daya wasn't breathing. When he called 911, Sandhu was told to tie off the umbilical cord with something, so he used his iPhone cable. Moments later, his son started crying.
Well, it leaves a scar in your mind forever, because to see your wife in such a condition and to have your baby in those circumstances, it was minus 25. Just be prepared. That is the advice I always give.
This one's your favorite.
As for Cornelius, a few days after this interview, she gave birth to her son, Jackson. Health officials in BC acknowledge it's disruptive for women to have to travel, but they say safety must come first. Cornelius understands that, but says a little financial help would be nice.
If you had somewhere to live, like a living arrangement or just some sort of just a fund going to help out, that would help a lot.
Because she says being pregnant and far from home is stressful enough. Briar Stewart, CBC News, Dawson Creek, BC.
So how big is that urban-rural divide Briar spoke of? Well, the latest numbers available paint a pretty vivid picture. Across Canada, more than 40% of rural deliveries involve travel of more than 1 hour. For 17%, the trip is more than 2 hours. In the north, the proportion of mothers traveling that long can exceed 99% and involve journeys by boat, plane, snowmobile, car, or bus. And in the cities, 90% of mothers traveled 30 minutes or less.